but we're going to talk about valley fever testing, and there's actually a sale going on right now at the lab, and I just found out about it, so this is really good timing. All right. All right, so valley fever testing. First, we're going to go over kind of a whole smattering of valley fever testing and ancillary testing, and then we'll dive more into the titer stuff because that's the more common test, and a lot of people have questions about that because that's usually the test that's run. It's the titer, valley fever titer that measures the antibodies, is the most common test. But there are other tests out there, and the valley fever titer does have limitations because we see false negatives for several different reasons. One reason is we see false negatives in the titer tests if we test too soon. So if it's a real early infection, the body doesn't have enough time to make those antibodies that they're detecting in the bloodstream with the titer test. And we'll also see false negative tests with really bad disease because it becomes walled off in the body and the immune system can't recognize it. So those are real tough, and we can have really sick dogs with valley fever and their test will be negative. So that's where your veterinarian has to be creative. And most veterinarians that are experienced with valley fever can be very creative in treating for valley fever in spite of a negative test. So yes, there's the titer, but there are also other tests. So if, for example, the titer is negative and your vet is like, oh, I think it's valley fever, or maybe you think it's valley fever, there's actually a confirmation test that you can run, the EIA, or the enzyme immunoassay test, and it's done at Mira Vista Labs, which can be a little challenging to find because not all vet clinics have an account with Mira Vista Lab, but they can get an account. So there's an EIA test that you can have run. It's another blood test for valley fever. So if you're really suspecting it, but the titer is negative, the next step is to try to confirm it with an EIA test. It's an enzyme immunoassay. So it's more sensitive than the titer test, but not all vets run that test and not all of them know about it. So you have to kind of ask. And I think I have a list of places that do run it, so I'll see if I can find that list and post it under the video. Then there's the rapid assay test, the lateral flow assay test for valley fever. And Dr. Jared Jaffe did the trials on that test and found that this test that can test for valley fever in 10 minutes, which is fabulous, has the same success rate as the titers. So you still get some false negatives, but if it's positive, and then you follow up with the titer later. So this is an ELISA test that can be done like at an urgent care or a pet hospital or a pet emergency center, that can give you results in just a few minutes. So treatment can be started right away. So that's really a big benefit to our valley fever patients, to get a diagnosis quickly and get on treatment right away. That improves their prognosis tremendously. So I put a message out to the vets in my Valley Fever for Vets group, and a few people responded to tell me that they had the lateral flow assay test, which is a rapid assay, the one you get back in like 10 minutes. Best Friends in Mesa, Animal Medical and Surgical Center, aka Thrive in Scottsdale, Continental Ranch Pet Clinic in Tucson, and the Veterinary Specialty Center in Tucson. So a good shout out for all those guys for having the lateral flow assay and getting valley fever diagnosed quickly. So if you're suspecting valley fever in your dog, and maybe we should go back and talk about that. So valley fever is a fungal infection. It's endemic in the Western United States, including Nevada, which I had a vet tell someone that they didn't have it in Nevada, but they do. It's endemic in the entire Western United States. The fungus lives in the environment. The spores are inhaled. Most of us have a good immune system to fight the infection right away so it doesn't take hold. But about 5 or 6% of us get sick. So people, dogs, cats, all mammals, but dogs are by far the most common patient that we see. So that's valley fever. And if your first symptoms of valley fever, because you're inhaling it into the lungs, are coughing, fever, lethargy, lack of appetite, achiness, kind of flu-like symptoms. So if that happens to your dog or yourself, I mean, we're talking about dog tests, but it happens to people too. So contact your physician for that. But with dogs, if your dog is just acting funny, has a respiratory infection, and no one can figure out what's going on, and they're sick for longer than you think they should be, make sure you ask for a valley fever test, no matter where you are, especially the Western United States. But if you've traveled with your dog to the West and you live in the East, you still need to have them tested if you've ever been out here with your dog. So you can ask for the lateral flow assay, see if they have the rapid test to get results right away. And also do the titer test, the IgG, IgM, which we're going to go over more in detail. All right, so there's also a PCR test. And a lot of these guys that I see that are really sick and I'm suspecting valley fever, but their valley fever test is negative, and the EI test is negative, I'll look for other fungal infections because there are more fungal infections than just valley fever. Another one that I've seen look like valley fever is aspergillosis. So I'll run a fungal PCR, which is another blood test. It tests for the DNA of all the fungal infections. So you're looking for valley fever, aspergillosis, cryptococcus, blastomycosis, histomycosis, all the fungal infections, to see if they've got one of them going on, if you're really suspecting a fungal infection, because they have all these fungal infections are tricky, and they can have variable symptoms, but the respiratory component is a common one. So a fungal PCR is a test where you can run all the different funguses and see if your dog has a different one than valley fever, or it can confirm if they have valley fever because it looks for the DNA. So that's a nice test to run if you need to. Another test that used to be done and is done a little bit more in human medicine are fungal cultures for valley fever. Generally, we don't do those. It would be like taking a sample and sending it to the lab and having them grow it on a petri dish and then identifying it as valley fever under the microscope. And the reason that this is not commonly done is because what grows in the petri dish is infectious to people and everyone. So it's a huge biohazard. So that's generally not done. Although when I was at the Valley Fever conference, they were running cultures in some of their research. And I was like, wow, I don't want to be involved in that research because valley fever is no fun to get. Another thing that can be done is cytology or histopathology. And that means looking at tissues or fluids under the microscope and looking for the fungal hyphae or the fungal spores in the sample. And so sometimes when I've had a dog with big lymph nodes everywhere, and everyone thinks lymphoma first, and they'll biopsy a lymph node, or they'll do a fine needle aspirate and cytology on a lymph node, and you can actually see the spores in the sample. or the spores in the sample to confirm that that's valley fever and probably not lymphoma, which is not any better, really. So you can also do histopathology or cytology like on bone biopsies. So that happens every once in a while where a dog will have a bone lesion and they take a sample of the bone and send it to the lab and they look under the microscope and see if they can see fungal elements. So this is a more advanced test and that requires anesthesia and it's quite invasive. So we don't always get there. I usually recommend before you get to a biopsy or histopathology that you've run all the lab work first. Check those labs, check for the other funguses before you get into the more invasive, riskier tests. And that goes with x-rays too. So you want to make sure you're getting an x-ray before you get into biopsying something. And x-rays are usually done like with the respiratory component when dogs are coughing all the time or having trouble breathing or are breathing funny or their color is just not good, like there's something wrong with their breathing. They'll do a chest x-ray, and that's really important with valley fever because you can see a certain pattern, although the chest x-ray pattern of a fungal disease can be very similar to a bacterial pneumonia. So that gets misinterpreted or missed sometimes. But if you combine that with your lab work, then that can give you a better indication that it's valley fever. If you've got a typical appearance on an x-ray of the lungs and you've got blood work to support it, that's great. And then that's something you can follow up with. So to make sure that the infection or the valley fever is gone, you re-x-ray down the line and you retest down the line and see what the difference is. X-rays, they may x-ray bones and joints because it likes to go there. CT scans and MRIs are done, especially when it's spinal cord or brain. Because if you've been on here, you know that valley fever can go anywhere it wants. It's sneaky. All right. And then some of the other tests that I'll usually roll into the valley fever, like the valley fever titer, you can get bundles of packages where they do a valley fever titer, but they're also doing a CC to look at blood cells, a chemistry panel to look at proteins and liver values and kidney values and electrolytes. They're running a thyroid screen. Those are really basic tests that should be done because if there's any question about the valley fever titer, like if it comes back negative, but you look at all this other lab work and you're seeing maybe some anemia and low thyroid and high liver enzymes and high proteins, those kind of things can tip you off to a fungal infection, really an infection in general. But if you're looking for valley fever, you look for certain things on the other lab work that may clue you in as a veterinarian. And the veterinarian would then be inclined to maybe treat the dog, even though the test was negative, and see if they get better. That's called trial treating. And sometimes that's not a bad idea. Other tests that I usually put together with that valley fever titer is I'll run a heartworm 4DX, which checks for heartworm disease. And it also checks for some of the tick-borne diseases. Heartworm and the tick-borne diseases can mimic valley fever, or valley fever can mimic them. So they have very similar symptoms. And granted, dogs can have both. They can have a tick-borne disease and valley fever. I've seen that before. So it's good to test for other things that look like valley fever and make sure you're treating exactly what you think you're treating. I'll also do a urinalysis, especially if there's kidney enzyme elevation, because the valley fever can affect the kidneys, but so can the medication conventionally that is used. So doing a urinalysis can be helpful, especially if there's kidney involvement. And then another test that is out there that some vets will recommend right off the bat when they see a dog come in coughing with a fever and lethargy and not eating in a valley fever endemic area, they'll not only run a valley fever test and the regular blood work, but they'll also run a respiratory PCR. And the respiratory PCR looks for things like distemper, kennel cough, influenza, all the other respiratory infections out there, so you can identify exactly what you're dealing with if possible. It's not a cheap test, so that's why a lot of people don't have it run on their dogs. But it's out there. And if you can run it in an early infection so you can know if it's kennel cough or valley fever or something else, that would be helpful. So you probably need to be aware that there is a respiratory PCR test that can be run with these respiratory cases with dogs with coughing and breathing issues. Okay, so let's get back to the titers. So the titers measure the antibodies that the body produces to the valley fever fungus. And it's measured in an IgM and an IgG. And the IgM will turn positive in the early infections, but not the really early infections. Sometimes you can miss it if you test too early, but you always want to try to test. So you get what you get. But IgM usually indicates an early infection if that's positive. Although I had a dog with a chronic case that had an IgM positive in the middle of treatment, and we were unsure if it was a reinfection or what the heck it was. And valley fever does what it wants, so you get these weird things happening. So the IgM is the early antibody, and then IgG is the antibody that shows up a little bit later. And if you've got positive for both, it's usually an early infection. If you've got negative for the IgM early antibody, but positive for the IgG later antibody, then it's a more chronic infection. And chronic could be 3 weeks or chronic could be 3 years. And so a positive IgG test is more than likely significant. Although, if a lot of people will do a routine test on their pets, like every year they'll check blood work and a valley fever test and maybe the heartworm tick fever test are in there too, just on an annual basis checking. And maybe the valley fever IgG comes up positive and the dog has no symptoms. And if it comes up positive with the value of the lowest value, so negative is negative, but the lowest positive value you can see is a less than 1 to 2. And a lot of vets will read a less than 1 to 2 on a dog with no symptoms of valley fever as an exposure titer, meaning they were exposed to valley fever, they got over it, they made some antibodies, doesn't need to be treated. And that's fine, because that happens quite frequently. The kicker, though, is when a dog has symptoms and you get one of these really low titers, the less than 1 to 2 titers, but you have symptoms, that's significant, because with the amount of false negative tests, if we actually get a little bit of a positive in a dog that has symptoms, they need to be treated, in my opinion. So a less than 1 to 2 IgG antibody level on a valley fever titer can be significant if the dog has symptoms. It may not be significant if it was just a routine test and the dog doesn't have symptoms. And symptoms may not be just respiratory. So we also have to consider that, which sometimes that gets missed. So a dog can have the respiratory symptoms, but it could be past that stage. And you could have bone and joint pain. They could have seizures. They could have skin lesions. They could have elevated kidney enzymes or liver enzymes. All of those things are symptoms of valley fever. Even with a low titer, that needs to be followed up and either a confirmation test done or treated as a trial treatment. So the titers go from negative to less than 1 to 2 to 1 to 2, 1 to 4, 1 to 8, 1 to 16, 1 to 32, 1 to 64, 1 to 128, and 1 to 256. And after that, they don't go any higher. They just stop. They just stop the number, because if it's higher than that, and they can go higher, they just don't test it. They just call it more than 1 to 256. But the thing is, even a high titer doesn't correlate with the severity of infection. So you could have a really, really, really sick dog and the titer could be low. You could have a dog that is just has some joint pain and the titer's really high. So it doesn't, the way the dog is presenting is not reflective in the level of the titer. That's just the way it is. So even if your dog has a low titer and they are showing symptoms, something needs to be done. And you should talk to your vet about that. I actually have a at-home valley fever testing bundle that does the valley fever titer, CBC, chemistry panel, T4, which is a thyroid screen, and the heartworm 40X test, which is heartworm and some of the tick-borne diseases. And I have that as a bundle, and you can access that at caninevalleyfevertest.com, the letter K, the number 9, valleyfevertest.com. And they're actually running a 15% discount right now on it. I didn't even know that till I checked. So you'll get an extra 15% off on this test. I don't know how long that lasts, but the at-home valley fever testing bundle, especially if your dog has symptoms, like weird symptoms that are persisting, like respiratory symptoms that they maybe look like asthma, or fevers that come and go, or limping, or swellings of the joint or bones, or back pain, neck pain, seizures. These all should be tested for valley fever. So that's a nice place to start with a nice blood panel or bundle of tests that can help you with that. And then, so what if your dog has valley fever and you know it, and you either know it because they're positive and they're under treatment, or their test may have been negative and your vet is treating them anyway because it was very suspicious and they got better with medication. So that's kind of a confirmation. The other thing we do when we try to confirm them by treating these dogs that have a negative titer is they have a negative titer. We still think it's valley fever. We put them on the antifungal drugs like fluconazole, and we put them on for a month or two. And at about the 4 to 6 week mark, we retest the valley fever test. And some of these guys will turn positive, which confirms our suspicions that they do have valley fever. So they will seroconvert, meaning they were treated for valley fever and they did really have it, even though their test initially was negative. And the medication mobilized the fungus in the body and allowed the immune system to recognize it. And then by retesting, we pick up the immune system that had made some antibodies after we had started treating the valley fever appropriately. And so that confirms they have valley fever. So then you continue the treatment. And conventionally, treatment continues in simple cases for 9 to 12 months. In the more severe cases, like spinal cord, brain, seizures, bone, those can be like a year or two of treatment. And some vets will will indicate that they might be on treatment for life, but that's something I disagree with. Because I think treating a dog with antifungals for life is dangerous because it suppresses the adrenal glands. And you can see Addison's disease with long-term antifungal use. So that's another story. That's another Facebook Live. Um, so with the titers, if you can do a confirmation titer if you're trial treating at the 4 to 6 week mark, and your vet should be doing that. Some vets don't or forget, I'm not sure. So remind them now that I've told you this. And how about if we have a dog that has a positive test, is being treated, and things are going great? Your vet will usually recommend testing every 1 to 3 months in the beginning. So, if it's kind of touch and go and they're not sure, they'll test every month. But if the dog is pretty stable and doing well, they'll go to then every 3 months. The dogs that are on long-term fluconazole or long-term antifungals for valley fever, like the ones with bone lesions and seizures, ideally we do every 3 months, but practically a lot of vets will go to every 6 months in testing, and modify medication with that. Okay. All right. So follow-up titers are usually every 1, 3, or 6 months, depending on how your dog is doing. If your dog is doing okay and then all of a sudden worsens, you'll want to do a titer right away. You don't want to wait like 2 more months to the 3-month mark. You just want to test again and test for whatever else your vet recommends. Usually you'll do that whole panel of lab work again, the CBC chemistry panel, T4, Heartworm 40X. You'll do that all again, along with the valley fever titer, and see if something has changed, see if it's affecting the organs or something. So that's all about titers. And let me see if we have any questions. So that's all about titers. Oh, there we go. Let me see if we have any. All right. I see a lot of thumbs up and highs, and people are on and watching. So thank you so much. Thank you for watching. I don't see any specific questions. So if you have any specific questions, throw them on the chat. I'll wait a minute and we'll talk about stuff. So, with the more severe cases of valley fever, like valley fever that causes seizures, they'll usually do like CT scans, MRIs, and a CSF tap and look for valley fever in the CSF tap. That's a real interesting one. And I think we had someone in the Facebook group with the dog with seizures, and they were wondering about, what to do and how to take them off, how to help them holistically and try to reduce the anti-seizure meds because they were messing the dog up. So, so those are all the tests. A little bit about titers. The key point is the titers are variable. They have to be interpreted with other things like the dog's symptoms, the other lab work, and even a negative test can be a positive valley fever dog. You just never know. Testing is variable. So titers are variable. There are follow-up titers or tests that you can do to try to confirm, like the EIA. There's a lateral flow assay, which is the rapid test that's available in some places to get results right away. And you want to just keep tabs on your dog, okay, with the testing. And I don't stop treating until the valley fever test is negative, the symptoms are gone, the x-rays are clear, whether it's an x-ray of the bone or the lungs or wherever the valley fever is. The lab work all has to be negative and cleared. And the dog has to have no symptoms of valley fever before I'll stop treating. And treatment can be the antifungal drugs, or it may be holistic strategies. So I use holistic strategies in dogs that can't tolerate the antifungals like the fluconazole and the itraconazole. When they have allergic reactions to those, there are actually antifungal herbal formulas that you can use along with other holistic strategies and diet therapy, which you should be using anyway, to help clear the valley fever. So I don't stop treating until the valley fever is negative, whether I'm treating with conventional meds, holistic meds or strategies, or a combination of both. Okay, and then don't forget there's a big sale on the at-home valley fever testing bundle at the lab. If you go to www.caninevalleyfevertest.com, you'll get to that valley fever bundle, and you can order it directly with the lab, and they'll come to your house and draw the blood. It's really cool. All right, everybody. Thank you for joining me, and have a wonderful Saturday. And I'll talk to you later.